Welcome to Adapt NCLEX Delegation and Assignment, one of the biggest traps on the NCLEX. Can you tell which task goes to the RN, LPN, or the UAP? These are NCLEX questions that nursing students commonly missed on my QBank, Adapt NCLEX QBank. So today I'm breaking them down exactly why. So let's test your knowledge on these questions so that we can make delegation and assignment easy to deal with. First question. What do you think? Which task is most appropriate for the LPN to perform? A nurse is assigning tasks to the LPN and a UAP. Which task is most appropriate? I'm going to give you a quick information to use to answer these kind of questions. There's a strategy to be able to use to make sure you can master that. This is the way I say RN is in charge of everything. So what did they do? They do the first of everything. They eat, evaluate, assess, and treat. The other thing they do is the RN. I call it what? Require nursing process. That's all. That's the mnemonic. The LPN, I call it MMR most. That means most medication they will give, they can reinforce, teach, most of the time adjective. They can do stomach care and tracheostomy, something specialized test. The other way to remember them is LPN, which is what? Low, right? Rex, that is predictable, and they need follow-up. Those are the patients you give it to. And the UAP, I said anything that does not require any thinking. It doesn't mean they don't think, but it does not require any nursing process or critical thinking. That means they assist and they report. They never assess or teach. That's all. That's the mnemonic we're going to use to answer every question. Therefore, which task is most appropriate? Based on what I'm telling you, provide post-care. This is for what? LPN, MMR most. Low risk, predictable, need follow-up. Check what? Intake and output. Weigh the client and insert fully. In this question, UAP, what did they do? ADL and mostly assist and report. Therefore, which answer choice you pick? Use that. You write it down and you look at it and say, this is what is going on. UAP is responsible for ADL and anything that does not require thinking. If you look at all the four options, which one would you choose? Put down in the comment and let me know. But you can see of non-steroid technique and one steroid technique. Post technique and it's ADL, it's a form of an ADL, so UAP would do that. Urine output checking, UAP would do that. Wearing the patient, UAP would do that. Inserting the Foley requires steroid technique. And so this is what the LPN is going to do. So this is the way we're going to approach this question. And this is the explanation. Like inserting a Foley catheter requires steroid technique. Therefore, a UAP cannot do that. This requires some nursing process that LPN will be able to do that. This was a tricky question. Low score based on my QBank. There's a reason why. I understand why. A lot of people pick the wrong answer. Which factor should the nurse prioritize when assigning tasks? That's the buzzword, assigning tasks, underlining, assigning. But pay attention to the word prioritize. It's the most important in the question. Always go for the words that will help you answer the question. This is the most important. Even though assigning tasks is okay, prioritize. That's why I underlined it. The charge nurse is delegating tasks to what? The LPN, right? What is the charge nurse going to use to delegate specific assignment to the LPN? Is it facility policies? Is it State Nurse Practice Act or client condition or the scale level of the LPN? Think about it critically. If you are the charge nurse or the nurse who is assigning tasks to LPN, which of these are you going to use? It's easy to mix on the NCLEX. That's why the score was very low on my QBank. But what do you think? Put down your answer. Let me know. Think about it carefully and select your answer. I give you a few minutes to do that and think about it. But I can tell you, based on the techniques you're going to use, everything on the NCLEX when it comes to delegation is all safety and scope. Once again, safety and the scope of practice. Therefore, to delegate to the LPN, based on that. But which one trump is the scope of practice. So your scope of practice is more important. It does not matter whether you experience or not. Your scope, what can the LPN do? That's all. So we're going to base it on facility policies. Okay, but that is not enough. It's not a priority because your hospital can come up with something that is they do, but that does not mean it's what the policy require nationally, right? This is your Bible. This is your legal document, the legal authority given to the LPN. Think about it. Client condition, yeah, the charge nurse will think about it and say, hey, this patient is sick, this is not sick, I can't give it to LPN. But does that trump your state's Nurse Practice Act, your Bible? Of course, you can be experienced, but that also trump this? Yeah, that's a problem. Therefore, what do you think? Which one are you going to take? The right answer, as usual, is the State Nurse Practice Act, which is your policy, your legal authority that tells you what you can do. When you get to the hospital, yes, they can tell if you're experienced, they can give you specific, but every time they have to go by your scope of practice. Which specimen collection task should the nurse delegate to the UAP? This is also a trap, but always go back to the key fact. The UAP does what? Assist and report and never assess or teach. They can collect things that are what? Non-sterile. That's all. Always when you see delegation question, I know they are trapped, but go with some key concept. Always when I do question, I don't just go for the answer. I try to teach you guys to use the concept and use it to answer the question, because that's what the NCLEX, they take the concept and put the meat around it and they create a question. Collect the wound drainage for culture. What do you think? Obtain urine from a Foley catheter for culture. What do you think? Draw blood for a lab test. What do you think? Collect a random stool sample, right? I told you the key is what? Sterile. The UAP doesn't go near sterile technique. If you have to select one of those, which one will you select? What do you think? Number one, well, even though the wound is infected, sometimes we need a sterile specimen to send. Therefore, they can't do that. We can also collect a sterile when we're collecting urine from the Foley catheter for your culture. It has to be sterile. When you're drawing blood, you don't want to contaminate it either. The stool is already contaminated. There's no sterile stool sample you can collect. Every time, all of them are already contaminated. So a UAP may collect routine non-sterile specimens such as random stool sample. This is the key to answer that question. So I'm showing you these are the explanation, very short explanation I usually give for my Q bank. Not a lot of information, but just to give you concept. Otherwise, you memorize everything. Which room assignment is most appropriate? This is also a key. Assignment is always play a major role. So pay attention. Key fact, there's a way you do assignment. A charge nurse is making room assignment for a child post appendectomy. One, child with what? Who is the patient going to be roomed with? One with sickle cell crisis, child with ptosis, child with concussion, child with what? Newly diagnosed asthma. What do you think? Which answer will you select? What concept do you use? The concept is what? Make sure the patient is not going to get infected. It's a post-op patient. We don't want the patient to get infected. If there's any infection here, stay away from that room. Do you see infection there? If you see an infection there, then stay away. I'm guiding you for the answer. Therefore, which one would you pick? There's a bunch of infection, and there's one that does not have infection. As my patient, you can assume something is going on. They may need a lot of work. They may have infectious process going on. We don't know, right? Ptosis, right? It's a newly diagnosed too. They're trying to figure out what is going on. This is also an infection that will make the patient sick. Sickle cell crisis, they're more likely to get sick easily because their spleen doesn't work. There is concept associated with them. They're more likely to get infection. The patient who have concussion is okay. He has nothing No problem. Therefore, you're going to be with that patient. Good luck, appendicitis patient. So that's the way to think about it. This is the safest. Always think about safety. This is another one. Which client is most appropriate to assign to a new graduate nurse? She's new. That means you treat her like anybody new. Even though a scope of practice required to do things, she may not have the skills to do extensive ones. So we give her still within the scope, but not a complicated patient. That's all. Stable, predictable. Treat her like the LPN. Stable and a predictable outcome. A charge nurse is making assignment to nurses, right? What? COPD, his site is 87. He's on roommate, 50-50, right? Client with diabetes, fasting glucose, 350, 50-50, right? Client with CAST, reporting 9 minutes, 50-50, right? What do you think? The client with diarrhea and abdominal pain, what do you think? Which one of these 4 patients, if you are the one charged nurse making an assignment, will you give this to a new graduate nurse who walks to the hospital? Let's break it down. I know you pick your answer, and I can see it down in the comment. Put it down in the comment and explain why. Number 5, you pick whichever you pick. But think about it. We're making an assignment. We want to make most appropriate. There is a word there. All of them can be assigned. That's why they underline it, most appropriate in the NCLEX. It doesn't mean the answer choice you pick is wrong. It's just is the most appropriate. Does he answer the question? This patient, even though they can live in 60s, 70s, 86, 87, we may think something is going on, so they need some advanced workup to make sure why his site is 87. Type 1 diabetes, glucose is too high. Is he having DKA? I don't know. CAST reporting 9 minutes, that's compartment syndrome, complicated patient. Diarrhea and abdominal pain, well, gastritis, I think we can handle her. She can handle her. Therefore, he or she can handle her. We give this patient to the new graduate, right? This is the way you think about it. This is the way you break down delegation and assignment. Don't let the NCLEX take these points away. They're going to come. Management of care and leadership questions. You got it. I know you got it. Make sure you take your point, whether you're in nursing school, they're going to give it to you. So just master the skills to find the right answer. They are not complicated. They just require some strategy to tackle them. The nurse is delegating, LPN, UAP, and then RN. There's tax going on. Which tax is appropriate for the LPN? The way I do this, when there's 3 of them, everybody stay in their lane. That's the concept. Once again, everybody stay in their lane. This is what I've seen. Excessive selection. That's what I've seen in my Q bank. That if you have 3 people, RN, a UAP, and an LPN, even though some of the work UAP can do, that LPN can do, we stay in our lane, driving lane. You don't cross over. Okay, that's the answer choice you pick. In real life, they can cross over and help each other. There's no helping in the test. A UAP, you do what you do. LPN, you do what you do. RN, you do what you do. And what you do as the RN, you eat. And like I said, require R, require N nursing judgment. A UAP is what? Assistant report, right? LPN is what? L is what? Low risk, predictable, and need follow-up. Or what? MMR most of the time, adjective, reinforce teaching, reinforce teaching, education, assessment, or just reinforcing them, not the initial one. Therefore, what do you think? Transport, that's the buzzword I'm picking. Transport is part of assisting and what? Helping ADL staff, the patient, even though they have stroke. That's not what the emphasis is on. The emphasis on the answer choice. Always look at it. Look at the answer choice the way it's written. It's like talking to you. Transport a client. So the main idea is about transporting 72 hours a stable patient. I put the stroke there to confuse you, to trap you, to make you think critically. Provide back rub, ADL, right? Even though you have right-sided weakness, it's not the problem. The action is what? You are delegating the action, not the patient. The action, that task that needs to be done is what is delegated. And so pay attention. Sometimes you get confused because you pay attention to the patient. Tax, robbing, right? Back rub is the tax. Exchange word, tracheostomy or the cannula, right? And an empty what? Drainage bag for neostoma. You can see a bunch of them are what? Activity of daily living or assisting with hygiene or helping, right? That don't require thinking. You empty the bag, that's all. You put it back. You rub the patient back, and then you transport the patient, no thinking. But if you have to change the tracheostomy cannula, this requires some sterile technique, despite the patient being stable. That requires special technique, thinking, nursing process involved. This has to be done by the LPN. That's why I call it MMR most. If I write it, this is what it look like. Tube feed and stoma. Any stoma, whether it's in your neck or your abdomen, colostomy, ileostomy, gastrostomy, tracheostomy, the LPN can do that. So that's my mnemonic to answer any question on delegation and assignment. What is your score so far? We are what? 6 points. I know you get 6 out of 6 because you watch adapting. And this video is helping you learn something about delegation. Subscribe for more content like that. Click on the like button and give me thumbs up. Good luck in your exams if you're about to take your exams and if you're in nursing school too. Number 7, a UAP reports that a client abdominal dressing is saturated with blood 1 day post-op. What did I tell you? Assist and report. Never assess or teach. That means anything that requires. I saw it and I'll talk about it. Assist and report. Therefore, which task should the nurse delegate to the UAP? What do you tell her? Obtain new dressing, go and change the dressing, pay for abdominal distension, or let the doctor know. What do you think? Number 7, which one would you pick? What do your answer would be? If you base on that content, guys, I can tell you, number 1 is the best answer, right? I'm going to the break room and just get a supply. Number 2, changing dressing may require some sterile technique and some nursing process. Palpating for the abdominal distension, nursing process, assessment, letting the doctor know, negative. Don't put the UAP through that. They have to make assessment, describe what they see, talk to the doctor, ask them what the doctor will ask, what have you done? That's not RN. That's not a UAP job. The RN, LPN, UAP are caring for a client with heart failure. Same strategy. Okay. Which task is okay for the UAP? Once again, that's not required thinking, ADL, and all you do, you assist and report. Don't to memorize a list. If you've seen the list, there are a bunch of functions LPN or UAP does. Please throw it away. And I want you to use this little, manageable, relatable information to answer questions on delegation. I said what? Report and assist. That's not require thinking. Therefore, any easy thing I can do, monitor. You see the word monitor is the key. The word monitor there, you know, that belongs to LPN. So I take that one there. Record. I'm recording. I'm not thinking. I look at the value and I put it down. I titrate some nursing process, some thinking. I have to look at the vitals and not figure out how high should I improve the oxygen. Educate. More information. Nursing process. I'm not responsible. You see the way I approach the question, words in the answer choice, and I can make it easy as much as possible. 2 more. A nurse is assigning care to an LPN on the medical surgical unit. I'm trying to give you all angles so that you can be comfortable. Which task is appropriate? Based on the answer I give you, the previous answers, you can see that this become easy. Develop a plan, develop, not monitor, not reinforce, no, right? That's not in the language of the LPN, MMR most. Monitor, reinforce, I don't see that. Or low risk and predictable, no. Evaluate, that's the it portion of the RNA. And effectiveness, reassessing, right? Administer, giving most medication, MMR most medication to a client. I never told you whether it's stable or unstable. You don't have to think that. Don't go that level of second-base thinking. I said gave medication, oral. Most medication is equivalent to giving medication to the patient, most. Therefore, this is equivalent to that. Perform admission assessment, initial assessment. There was nothing in the formula I gave you. Therefore, this is our answer. And the last one, what is your score so far? How are you doing? How is the status going? I know you're doing well. Keep on going. But 10 is you. Make me proud. What is your answer? A charge nurse is assigning client for the shift. Which client should be assigned to the most experienced RN? The most experienced RN. Post-op client ready for discharge. Client with newly inserted chest tube and bubbling in the water seal chamber. Client requesting pain medication for chronic back pain. Client who need vitals 30 minutes after blood transfusion. Break it down. Break it down to the lowest level and then answer the question. What do you think? Which one would you pick? Everybody, if you're watching here and you hear number 10 question, thank you for staying to number 10 and good luck in your exams. But I need you to put down in the comments and let me know, number 10, what do you choose? The word experience when it comes to RN in certain situation, it matters. That's why this question is applied. Is within the scope. The word experience means even though it look big, still within the scope of the RN. But in this situation, they are all within the scope of RN job. Therefore, which one would you pick? You got to pick the most serious and the most complicated one. Ready to discharge is stable, even though it's RN job. New patient, bubbling in the chest tube, pneumothorax, bad problem. Pain medication is stable. Blood transfusion, 30 minutes, you should be good. If you need a transfusion reaction, will have been the first 15 minutes. Therefore, I'm good. Therefore, what do you think? Which answer did you select? I know what you select because you watch Adapting Class and because you master the content associated with this. Going on for discharge is fine, but this patient is unstable because of the bubbling, need more attention. Pain medication is okay. Transfusion after 30 minutes, you're good. So that's your right answer. So as you can see, this is the way you should approach questions with delegation and assignment. And remember, on the NCLEX, every time you see delegation questions, they are all safety. When in doubt, ask, is the client stable, right? Does this require judgment, right? If it does, then it's the RN job. If it doesn't, then figure it out whether it requires some monitoring, reinforcement, and that is the LPN. And then later on, if it doesn't require any judgment thinking, and all you need to do is assist and report a UAP. Thank you for watching. If you need more questions, like prioritization questions, I will link a video. I did 85 questions that you can watch. Yes, detailed explanation of delegation. The first 10 questions, more of that strategy to answer them. But 85 questions, English practice question, it can help you in your nursing journey and nursing school. Take care of yourself and good luck. Bye-bye.